Hi, I'm Juan Pablo Arab. I'm an associate professor of medicine and director of alcohol sciences at the Stravitz-Sanyal Institute for Liver Disease and Metabolic Health. Very early in my career, when I was in med school, at that time, we used to take care of only one patient at a time, and you follow that patient for a couple of weeks every day, talking to them. And actually, my first patient was a liver patient, was a patient with alcohol-associated liver disease. And he had very advanced disease. He had cirrhosis. He got admitted because of GI bleeding, and I followed during all his admission to the hospital. Unfortunately, he developed complications, and I was able to witness how he decompensated and he finally passed. At that time, I realized how we didn't have effective therapies and also how all the alcohol related liver disease had a significant stigma. But later in my career, when I was in residency, I had a similar case, but at that time, a different team and a great mentor. Fortunately, this time the patient was able to get all the great care and got finally a liver transplant and went back to work and had great outcomes. At that time, I realized that with effective liver therapies, a patient can do so well. So I think it's important to recognize that liver disease is multifactorial. If we consider what are the main drivers of liver disease worldwide, are basically two. One is alcohol, and number two is metabolic dysfunction. It's fatty liver is basically associated with obesity and diabetes. If we consider that in the US, 70% of the population has overweight or obesity and nearly 15% has diabetes, we are talking about important numbers. But not everyone is going to get liver disease. So there is other factors. One of those factors is the genetic predisposition. And there is where particularly Hispanics has some genetic predisposition to have more liver disease, but also patients that are not Hispanic and has family history of liver disease in the family should be aware that they need to have the liver checked because they may have liver disease without knowing. As director of alcohol sciences, my role is overseeing all the operations that we have regarding alcohol-associated liver disease from a clinical perspective, trying to develop protocols and how we assess and treat our patients with alcohol-associated liver disease. Also from a research perspective, all the research efforts that we are trying to bridge the gap on treatment and also diagnosis of this population, and then also in teaching, in training the next generation of doctors and specialists that are going to treat these patients. So I think our Liver Institute has a very broad vision, and we are trying to be the leaders on liver disease at multiple levels, and particularly on alcohol-associated liver disease. We are trying to be cutting-edge technologies and very innovative in how we approach this disease and how we can transform the care for patients with liver disease. So most of my research is based on alcohol-related liver disease or alcohol-associated liver disease, and particularly a very severe form, which is called alcohol-associated hepatitis. Alcohol-associated hepatitis is when the liver gets sick in the acute setting because of intoxication with alcohol, and it has a very high mortality, up to 50% of 3 months. So I'm focused on trying to understand what are the trends on alcohol-associated liver disease and why more young people is getting sick, especially females, and especially in some ethnic minorities. So understanding also the social determinants of health on getting liver disease. My research also focused on identification and early biomarkers of the liver disease. So basically early identification of those patients that are progressing with the disease but are not having symptoms. And lastly, being able to identify better therapies. For the last 40 or 50 years, we have not really progressed on medical therapies for patients with alcohol-associated liver disease. But now, over the last few years, new drugs are coming, new medications, and also new treatments, including liver transplantation and early liver transplantation for this population, which is very exciting because we finally have alternatives to offer to these patients that are very sick.